Good day everyone. Welcome to Teacher Julie channel. Hello everyone. We have our new topic in MAPEH Health, which is all about the non-communicable disease, its cause and effect, signs and symptoms. So this will be the fourth quarter topic and module number 1. For the objectives of this lesson, we will focus our learning objectives with the following. First is to identify the non-communicable disease. The second one is to explain non-communicable diseases based on cause and effect, signs and symptoms, risk factors, and protective factors, and possible complications. Before we start on our proper discussion, so let us try this activity called Look for Me. So all you have to do is to look for the non-communicable diseases. Look the 5 non-communicable diseases in the word pool. Non-communicable disease are not caused by pathogens or disease-causing organisms such as bacteria or viruses, but rather by how people live, by the conditions which they are born, or by the hazards around them. It is also includes diseases caused by a breakdown of the body tissues, poor diet, environmental and occupational hazards, stress, and tensions. The following are some common non-communicable diseases. First one is allergy. Allergy is misguided reaction to foreign substances by the immune system. The allergic reaction is misguided in foreign substances that are usually harmless. The substances that trigger allergy are called allergen. Examples include pollens, dust mite, molds, dunders, and certain foods. People prone to allergies are said to be allergic. Now let's talk about the cause and effect of allergy. Airborne allergens such as pollen, animal dander, dust mites, and mold can cause allergy. Certain foods, particularly peanuts, tree nuts, wheat, soy, fish, shellfish, eggs, and milk can cause also allergy. Another cause and effect of allergy is insect stings, such as from a bee or wasp, medications, particularly penicillin or penicillin-based antibiotics, latex, or other substances you touch, which can cause allergic skin reactions. The following are the most common signs and symptoms of allergy: running nose, stuffy nose, sneezing, nasal itching, itchy ears and throat, postnasal drip, and rashes. The following are the risk factors of allergy: have a family history of asthma or allergies such as hay fever, hives, or eczema, are a child, have asthma or another allergic condition. The following are the preventions of allergy. Avoid known triggers even if you're treating your allergy symptoms. Try to avoid triggers. If, for instance, you're allergic to pollen, stay inside with windows and doors closed when pollen is high. If you're allergic to dust mites, dust and vacuum and wash bedding often. Another prevention of allergy is to keep a diary. When trying to identify what causes or worsen your allergic symptoms, track your activities and what you eat. When symptoms occur and what seems to help, this may help you and your doctor identify the triggers. Another prevention if you have allergy is to wear a medical alert bracelet. If you have a severe allergic reaction, a medical alert bracelet or necklace lets others know that you have a serious allergy in case you have a reaction and you're unable to communicate. The following are the complications of allergy. Anaphylaxis. If you have a severe allergies, you're at increased risk of this serious allergy-induced reaction. Foods, medications, and insect stings are the most common triggers of anaphylaxis. Another complication of allergy is asthma. If you have an allergy, you're more likely to have an asthma, an immune system reaction that affects the airways and breathing. In many cases, asthma is triggered by exposure to an allergen in the environment or allergy-induced asthma. Another complication of allergy is sinusitis and infections of the ears or lungs. Your risk of getting this condition is higher if you have a hay fever or asthma. Another common non-communicable diseases is asthma. Asthma is a condition in which your airways narrow and swell and may produce extra mucus. This can make breathing difficult and trigger coughing, a whistling sound or wheezing when you breathe out, and shortness of breath. The underlying cause of asthma is not known, but it is thought to be the due of combination of genetic and environmental factors. People with asthma may have genetic condition or genetic risk factors that make them more susceptible to the disease, and certain environmental factors such as exposure to allergens or certain viral infection in infancy may increase the risk of developing the disease. The following are the most common signs and symptoms of asthma: shortness of breath, chest tightness or pain, wheezing with exhaling, which is common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing or wheezing, attacks that are worsened by a respiratory virus such as a cold or a flu. The following are the risk factors of asthma: having a blood related with asthma such as a parent or sibling, having another allergic condition such as atopic dermatitis, which causes red, itchy skin, or hay fever, which causes a running nose, congestion, and itchy eyes, being overweight, and being a smoker. Another risk factors of asthma is the exposure to secondhand smoke, exposure to exhaust fumes or other types of pollution, exposure to occupational triggers such as chemicals used in farming, hairdressing, and manufacturing. The following are the prevention of asthma. While there's no way to prevent asthma, you and your doctor can design a step-by-step plan for living with your condition and preventing asthma attacks. Follow your asthma action plan with your doctor and healthcare team. Write a detailed plan for taking medications and managing an asthma attack. Then be sure to follow your plan. Another prevention of asthma is to identify and avoid asthma triggers. A number of outdoor allergens and irritants ranging from pollen and mold to cold air and air pollution can trigger asthma attacks. Find out what causes or worsen your asthma and take steps to avoid those triggers. Another common non-communicable diseases is diabetes. Diabetes is the mellitus referred to a group of diseases that affect how your body uses blood sugar or glucose. Glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissues. It's also your brain's main source of fuel. The following are the most common signs and symptoms of diabetes. Some of the signs and symptoms of type 1 diabetes and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine. Ketones are a byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Another common signs and symptoms of diabetes is fatigue, irritability, blurred visions, slow healing sores, frequent infections such as gums or skin infections, and vaginal infections. The following are the risk factors of diabetes. Family history. Your risk increases if a parent or sibling has type 1 diabetes. The second one is environmental factors. These are the circumstances such as exposure to a viral illness likely play some role in type 1 diabetes. Another risk factors of diabetes is the presence of damaging immune system cells called autoantibodies. Sometimes family members of people with type 1 diabetes are tested for the presence of diabetes autoantibodies. If you have these autoantibodies, you have an increased risk of developing type 1 diabetes, but not everyone who has these autoantibodies develops diabetes. Another risk factors of diabetes is inactivity. The less active you are, the greater your risk. Physical activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Another risk factors of diabetes is your age. Your risk increases as you get older. This may be because you tend to exercise less, lose muscle mass, and gain weight as you age. But type 2 diabetes is also increasing among children, adolescents, and younger adults. The following are the prevention of diabetes. Eat healthy foods. Choose foods lower in fat and calories and higher in fiber. Focus on fruits, vegetables, and whole grains. Strive for variety to prevent boredom. Get more physical activity. Aim for about 30 minutes of moderate aerobic activity in most days of the week, or at least 150 minutes of moderate aerobic activity of a week. Another prevention of diabetes is that don't try to lose weight during pregnancy. However, talk to your doctor about how much weight is healthy for you to gain during pregnancy. To keep your weight in a healthy range, focus on permanent changes to your eating and exercise habits. Motivate yourself by remembering the benefits of losing weight, such as a healthier heart, more energy, and improved self-esteem. Another common non-communicable diseases is cancer. Cancer refers to any one of the large number of diseases characterized by the development of abnormal cells and divide uncontrollably and have the ability to infiltrate and destroy normal body tissue. Cancer often has the ability to spread throughout your body. Cancer is the second leading cause of death in the world, but survival rates are improving for many types of cancer, thanks to improvement in cancer screening and cancer treatment. The following are the most common signs and symptoms of cancer: fatigue, lump or area or thickening that can be felt under the skin, weight changes including unintended loss or gain, skin changes such as yellowing, darkening, or redness of the skin, sores that won't heal, or changes to existing moles, changes in bowel or bladder habits, persistent cough, or trouble breathing. Another common signs and symptoms of cancer is difficulty in swallowing, hoarseness, persistent indigestion or discomfort after eating, persistent unexplained muscle or joint pain, persistent unexplained fevers or night sweats, unexplained bleeding or bruising. The following are the risk factors of cancer. One of the risk factors of cancer is your age. Cancer can take decades to develop. That's why most people diagnosed with cancer are 65 or older. While it's more common in older adults, cancer is not exclusively an adult disease. Cancer can be diagnosed at any age. Another risk factors of cancer is your habits. Certain lifestyle choices are known to increase your risk of cancer. Smoking, drinking more than one alcoholic drink a day for women of all ages and men older than age 65, or 2 drinks a day for men aged 65 and younger, excessive exposure to the sun or frequent blistering sunburns, being obese, and having unsafe sex can contribute to cancer. Another risk factors of cancer is your family history. Only a small portion of cancers are due to an inherited condition. If a cancer is common in your family, it's possible that mutations are being passed from one generation to the next. You might be a candidate for genetic testing to see whether you have inherited mutations that might increase your risk of certain cancers. Keep in mind that having an inherited genetic mutation does not necessarily mean you'll get cancer. Another risk factors of cancer is your environment. The environment around you may contain harmful chemicals that can increase your risk of cancer. Even if you don't smoke, you might inhale secondhand smoke if you go where people are smoking or if you live with someone who smokes. Chemicals in your home or workplace such as asbestos and benzene are also associated with an increased risk of cancer. The following are the prevention of cancer. Stop smoking. If you smoke, quit. If you don't smoke, don't start. Smoking is linked to several types of cancer, not just lung cancer. Stopping now will reduce your risk of cancer in the future. Another prevention of cancer is to avoid excessive sun exposure. Harmful ultraviolet or UV rays from the sun can increase your risk of skin cancer. Limit your sun exposure by staying in the shade, wearing protective clothing, or applying sunscreen. Another prevention of cancer is to eat a healthy diet. Choose a diet rich in fruits and vegetables. Select whole grains and lean proteins. Exercise most days of the week. Regular exercise is linked to a lower risk of cancer. Aim for at least 30 minutes of exercise most days of the week. If you haven't been exercising regularly, start out slowly and work your way up to 30 minutes or longer. Another prevention of cancer is to maintain a healthy weight. Being overweight or obese may increase your risk of cancer. Work to achieve and maintain a healthy weight through a combination of a healthy diet and regular exercise. Another prevention of cancer is to drink alcohol in moderation if you choose to drink. If you choose to drink alcohol, limit yourself to 1 drink a day if you're a woman or any age, or a man older than age 65, or 2 drinks a day if you're a man 65 years old or younger. Another common non-communicable diseases is arthritis. Arthritis is the swelling and tenderness of one or more of your joints. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with your age. The most common types of arthritis are osteoarthritis and rheumatoid arthritis. The following are the most common signs and symptoms of arthritis. The most common signs and symptoms of arthritis involve the joints, depending on the type of arthritis you have. Your signs and symptoms may include pain, stiffness, swelling, redness, decreased range of motion. The following are the risk factors of arthritis. Family history. Some types of arthritis run in families, so you may be more likely to develop arthritis if your parents or siblings have the disorder. Your genes can make you more susceptible to environmental factors that may trigger arthritis. Another risk factors of arthritis is your age. The risk of many types of arthritis, including osteoarthritis and rheumatoid arthritis, increases with your age. Another risk factors of arthritis is your sex. Women are more likely than men to develop rheumatoid arthritis, while most of the people who have another type of arthritis are men. Another risk factors of arthritis if you have previous joint injury. People who have injured a joint, perhaps while playing sports, are more likely to eventually develop arthritis in that joint. Another risk factors of arthritis is obesity. Carrying excess pounds puts stress on joints, particularly your knees, hips, and spine. People with obesity have a higher risk of developing arthritis. The following are the complications of arthritis. Severe arthritis, particularly if it affects your hands or arms, can make it difficult or for you to do daily tasks. Arthritis of weight-bearing joints can keep you from walking comfortably or sitting up straight. In some cases, joint may become twisted and deformed.